All right, I'm going to be doing my special populations presentation over diabetes. Some physiology and anatomy behind diabetes. Starting with what is diabetes? Diabetes is a chronic disease that affects the body's ability to use and produce insulin correctly. Insulin is a secondary messenger that's going to help get blood glucose into the muscles and cells to use as energy or store as glycogen to use for energy later. Which is going to cause a rise in blood sugar if there is insufficient insulin production or use from blood sugar being trapped, obviously, in the blood. There are several different types of diabetes, but in this presentation, I will be talking about 3: type 1 diabetes, type 2 diabetes, and prediabetes. Another common type of diabetes is also gestational diabetes that occurs in pregnant women. The main impacted system is obviously the pancreas, but it affects every physiological system in the body. The blood vessels from blood sugar being way too high for too long, nerves, like in peripheral neuropathy, which you'll learn about later in this slide, your organs, extremities, and your immune system. Type 1 diabetes mellitus is caused by a destruction of beta cells, which are also produced by the pancreas, which will lead to insulin deficiency, which will require lifelong exogenous insulin, which is going to be, put into the body through use of needles like insulin pens or like a glucose, like a Dexcom, sorry. Hyperglycemia is a result of too high blood sugar levels without exogenous insulin. Hyperglycemia levels, fasting, are normally 130 plus, and then normal levels, like non-fasting, over 180. Hypoglycemia requires carbs and glucose to raise the blood sugar from low levels, which is normally under 70. Hyperglycemia, high blood sugar, can lead to ketoacidosis, which is a life-threatening complication that occurs from diabetes when the blood lacks the insulin to pull the blood or the sugar out of the blood. Without the insulin being used right, the body will break down fat, producing acidic chemicals called ketones, and then that makes the blood very acidic and dangerous. Type 2 diabetes, which is the most common form, is going to occur when blood glucose is too high for too long. The body's going to stop making insulin, or it'll just stop using it effectively, which will lead to sustained hyperglycemia. This one's also known as insulin resistance. I kind of explain it as your insulin or your blood sugar is just really being really annoying and someone tries to tune it off. That's what the TK receptors are doing on the cell surface. It's going to kind of tune out all the insulin, like trying to get into the cell. And then obviously it's going to downregulate those receptors, so they're just going to stop working. It's common in overweight individuals, people with high blood pressure, sedentary behavior, or just basic genetic reasons. Prediabetes is high blood glucose levels. The body isn't producing insulin the right way, or it just isn't using it. Higher than normal blood glucose levels, but they aren't high enough to typically be diagnosed as type 2 diabetes. They do give you more of a risk to develop type 2 diabetes in the future, though. But the thing with prediabetes is it is very reversible through weight loss, adjusting your diet, getting your 75 to 150 minutes of moderate to vigorous physical activity a week, and also just getting good sleep. These are 3 images that kind of depict what happens. So you have your normal pancreas on the left that's, producing insulin. The insulin and glucose are going to kind of bind together, and the insulin receptor accepts them and they go into the cells. In type 1 diabetes, insulin is not being produced, so there's nothing to help get the glucose into the cell. And then in type 2 diabetes, insulin's produced, and then the glucose tries to go into the cell like with the insulin, but the little receptors aren't accepting the insulin because those receptors have resisted it. The impact of diabetes. Long-term impacts are cardiovascular risks, like risks for cardiovascular events like a heart attack, nerve damage, and financial strain from all the medications you have to pay for and like doctor visits and upkeep. Daily impacts that people have to deal with are like sleep disruptions from having to manage your highs and lows during the middle of the night, stress and depression just from, obviously the stress of having to deal with this disease, and management of medication. Obviously, the medication, you have to have it with you at all times. You have to have all your monitors with you, and you just literally have to make sure you have all this stuff to live. So management of that, and then obviously the medication costs, all ties back into like the financial strain. This image is just kind of depicting some of the complications that can come from it. Some of these I'll talk about in future slides, like the retinopathy and blindness and peripheral neuropathy. But it also shows how a healthful diet and exercise can help prevent some of these complications. Exercise rationale. So why is exercise needed? Exercise is a great managing device for diabetes. Not only is it going to help you like physically by increasing insulin sensitivity or reducing your cardiovascular risk because you're improving your cardiovascular fitness through exercise. It's also going to provide weight management because you're exercising, obviously, and it's also just going to enhance your quality of life. The main thing I want to hit on though for this presentation is it provides a backup way for calcium to signal GLUT4 translocation to allow glucose to be used in the muscle directly without the use of insulin, which obviously is going to lower your blood sugar without having to rely on that insulin or those TK receptors like in type 2 diabetes. It's just a really good way to lower the blood glucose levels. And then with muscle contractions like in exercise, those are obviously being produced with a lot of amounts of calcium, which is what's going to let the glucose directly into the muscles. Some of the ACSM recommendations from the textbook for aerobic exercise, they use the FIT recommendations. Frequency is 3 to 7 days a week. Intensity, moderate to vigorous. Time, 150 to 300 minutes a week, or 75 to 100 minutes a week at a vigorous intensity. And then types of exercise could be any prolonged rhythmic activity using large muscle groups. I have some examples on the next slide. And then the strength training recommendations using the FIT principle again are going to be a minimum of 2 non-consecutive days a week because you want to give your muscles time to heal. Intensity is going to be moderate to vigorous because you do want to go to a near fatigue. Time, you want to do at least 8 to 10 exercises with 1 to 3 sets of 10 to 15 repetitions, obviously to near fatigue. And then type any resistance machines, weights, or bands. And then here's some available exercise options to pretty much anyone, running, walking, cycling, or swimming, and then any continuous HIIT workout. You can do these with obviously resistance bands, body weight, and then moving into some resistance training ones, you can use free weights, resistance machines, or just any weights. And then you could always just play sports, basketball, softball, volleyball, Pilates, anything. I feel like every area pretty much has some access to some form of exercise. If it's literally just walking around your house, it's something. Here's my supporting article that shows how exercise is beneficial for people with diabetes. It was conducted in Ethiopia on participants above the age of 18, and they had to have type 2 diabetes. And there was 40 participants in this survey. There was 4 different groups tested. There was an aerobic training group, a resistance training group, a combined aerobic and resistance training group, and then a control group. Before and after the 12 weeks of training, they tested blood glucose levels, blood pressure, and body composition. These were 60-minute total workouts with a 10 to 15-minute warm-up and then a 10 to 15-minute cool down on each side. All workouts were overseen by fitness professionals to make sure they were done correctly. The findings were that participants at week 1 compared to week 6 were able to perform a full workout without having to take breaks, so they showed a lot of improvements in cardiovascular health. There was also significantly different results regarding the pre-test and post-test. There was obviously a shown reduction in blood glucose, blood pressure, and body composition, and then a combination of resistance training and aerobic training group. That combination group showed the most significant improvements, and for anyone who was hoping to get like the benefits, they should definitely do a combination of both. some management tools for for diabetes, for type 1 or type 2, mainly used in type 1 though. CGMs, or continuous glucose monitors, are just a small wearable monitor that's going to continuously, obviously, monitor blood glucose levels. And then I have some common types listed for all of these that I'm about to go over. Wearable insulin pumps are a device that will inject insulin into your body through like a cannula or a tube, which can be used for a couple days at a time. Common types are like an Omnipod. Insulin pens, which are reusable or disposable, that little pens that can inject insulin into the body. Some of the reusable ones are a little bit more techy, and they can track dosages and make calculations for like amounts of needed insulin. But then the normal pens, you can just click to an amount that you need, and then you can inject it in your body. Blood glucose meters are just kind of the most basic, like finger prick tests that are just gonna check a drop of blood. They're pretty reliable, and then these are also used to like calibrate your like CGMs. Special considerations from the ACSM: small little breaks of exercise throughout the day can really benefit insulin and blood glucose levels. Obviously, stopping the sedentary behavior, getting up, going on a little walk around lunch break, or just getting up every hour if you can, really just helps. Any movement or physical activity is going to help. Regular aerobic exercise helps manage blood glucose, obviously, through the muscle contractions, getting calcium in the second way. HIIT exercises or more intense workouts are gonna work more than moderate or low intensity exercise. While consistent aerobic exercise can lead to blood glucose, or can keep blood glucose in check, working out's gonna take energy, and it's gonna take, your blood glucose, it's gonna diminish those stores. So you're going to have to keep an eye on your levels while you're working out a ton, and keep that in consideration while you're working out. If you feel like a low is going on, you probably should check and then supplement. And then being active after meals reduces blood glucose, which will take me into my next slide. Some modifications: healthy diet, obviously, trying to eat some more nutrient foods. Exercise is kind of what I've talked about throughout this entire presentation. Reducing your sedentary behavior, getting up and walking. And then post-meal walking was something I found super interesting, which is going to stabilize your blood sugars by sending all of the sugar to your muscles like right after you eat, which will reduce like a post-meal spike in blood sugar. This is something that I think I'm actually going to start doing. I thought about it a while ago because I had heard something about it, and I just think that's super interesting. And then some unique risks are peripheral neuropathy, which is going to affect the sensitivity of your feet, legs, and hands, arms, and it can lead to sores, injuries, and possible amputation if they become infected or anything like that. Diabetic retinopathy is high blood pressure that will cause damage to the vessels on the back of the retina. The retina is really important in vision, and it basically like produces the images and takes them in and converts them to what you're seeing. So it can lead to blindness and vision problems. And then diabetic ketoacidosis, as I shared earlier, is just life-threatening. But a unique risk I had found when doing some research was that when your body is breaking down the ketones, it can produce a like fruity or acetone smelling breath. I just thought that was super interesting. But overall, physical activity is very beneficial for individuals that are impacted with diabetes of any type. And I hope you learned something throughout my presentation. Here are some of my resources.